Now we're going to go to Dr. Manish about the collaborating with key stakeholders. The floor is yours.
Thank you, Riyadh. Thank you, Tom and Yadin. What an impressive series of webinars. Truly congratulate everyone, Tom, Yadin, and the rest of the team in putting a wonderful event together. I'm truly honored and privileged to share my thoughts with this group because it's going to take a village like ours to really move healthcare forward to the new frontiers, especially after COVID. Next slide, please. So as some of you may know, I've been a serial CMIO, have had an opportunity to work with some really amazing teams and organizations and leading digital transformation. I currently serve as the senior advisor for the Albright Stonebridge Group, and I also am the CEO of Beyond Horizon Health Consulting Services. And before I begin any talk, I'd like to frame our world with this simple diagram. And I think this is what unites all of us. You know, we all wear different specialty hats, whether it's a CE or a physician or a nurse, but ultimately what brings us together is patients and people and problems that need to be solved to make healthcare better for the people we serve. And as I look at our world today, and when we look at healthcare from the microcosm of the key challenges of safety and quality, access to care, cost of care, and workforce issues. These are endemic. In fact, they're a pandemic within themselves. And when I look at the sobering data, 1 in 10 admissions leads to an event globally. 1 in 300 admissions leads to death. 43 million people globally are injured worldwide due to unsafe care. And this is from a report from the WHO. Access to care continues to be a challenge despite the large amount of money that's spent in healthcare. According to the World Bank, at least half of the world's population cannot obtain access to essential services. And when you look at cost, not only are we spending about 10% of global GDP on healthcare, about 800 million people, or about 1/7 of the global population, spends about 10% of their household budget on healthcare. And 100 million of these individuals are often pushed into poverty because of the expenses of healthcare. And when we look at workforce challenges, and I'll talk about this a little bit, not only do we have a maldistribution of resources, we also tend to work in silos. And we also, in the process, create significant inefficiencies within our healthcare ecosystems. And then when we look at how these inefficiencies lead to burnout, we have a compounding effect. And I think we all need to come together as one group to say, how do we solve these quintessential challenges in healthcare? Next slide, please. COVID-19 has further magnified the state of healthcare. Health disparities are magnified. There are funding and capacity constraints. We've seen quite acute supply chain challenges and critical shortages where we couldn't even get enough PPE to frontline providers. Our workforce has been under duress. When you start looking at the opportunity cost where chronic disease management and non-COVID related acute care, mental health services, child health, especially abled health, they've all been sidelined or delayed because the system has been overwhelmed by taking care of COVID-19 patients. And this is simply not acceptable. Yes, we have absolutely seen a regulatory response. And while it's been good, many of us are thinking, hasn't it come a day late and a dollar short? Because a lot of us in the leadership positions have been talking about the need to reform regulations. Think about how quickly regulators allowed in the US to practice medicine across state boundary lines. And that was one of the biggest barriers to practicing telehealth or expansion of telehealth in the US. We also were reimbursing for telehealth services. And that was another constraint to the expansion of those services. And so we did switch quite rapidly in kind of a chaotic manner to remote care. And I hope, and I'm hopeful that some of these trends are going to continue beyond the pandemic. Ultimately, the silver lining from this cloud, as Riyadh mentioned earlier, is that I think we are headed towards an era of digitally distributed healthcare ecosystem, where healthcare now will not be defined by the four walls of a hospital or a clinic. We are going to need to think about new ways to connect with our patients where they are, when they need us, and give them the care that is of high quality, safe, and is actually is in a cost-effective paradigm. Next slide, please. So here's an interesting factoid. More people around the globe have access to mobile phones than clean water, electricity, or toothbrushes. It's pretty eye-opening when we realize the power technology has given us over the last 20 years. Next slide, please. So when we look at the data on adoption of technology in the US, you see the curves for electricity and for landlines. And when you look in the far right of this diagram, you see how steep the slopes are for everything mobile, everything from cellular phones to computers to internet, smartphones, and so forth. And when we look at the developing world, we see a similar trend where, in fact, mobile line curve is essentially a flat line until about 2000 to 2010. And all of a sudden, you see a big spike in adoption of mobile technologies. And I think that is transformative, where now almost every individual on the planet has access to a number of services, including healthcare. Next slide, please. We've also seen a rapid proliferation of devices, and we've seen changes in consumer behavior, where digital content, digital services are widely accepted. And now, as a result of COVID, we've seen an increased proliferation in wearables, telehealth, and precision health services. And this trend is going to continue. But I think it'll get more organized, where we are now able to build services that are going to allow us to create an ecosystem to connect with patients and actually give them and reach them where it serves them the best. Next slide, please. So when you look at this data, I find this slide quite amusing at the amount of data that's being generated from all the interactions we have, from Zoom to social media, to communications, to meetings, and so forth. And what this is causing is a rich source of insights. And we are going to see a similar trend, I think, that's going to take a strong hold in healthcare as wearables and devices become much more commonplace in healthcare. But there's going to be a downside effect of this as well. Next slide, please. We are going to see an exponential growth of data. And when you have data that's unorganized, that's not contextualized, and that's just simply provided to an end user, whether it's a patient or a doctor or a clinical engineer, it creates a tsunami effect. And this is where now thinking about how do we begin to not only generate data, but generate good quality data, and how do we connect these large data sets through health information exchanges within countries, but also across countries, and are able to sort of leverage newer technologies like artificial intelligence or augmented intelligence, as I'd like to refer to it, and provide insights at the point of decision making, whether it's to a patient, whether it's to a physician, whether it's to a nurse, whether it's to any stakeholder. Next slide, please. So the data is there, and in the interest of time, I'll sort of rush through this a little bit. The remote patient monitoring market is going to grow significantly. And I think this is where I think clinical engineering is also going to expand in its role base. Not only are we looking at critical care capacity in hospitals, but also in the virtual and the home care space, where we are going to need more talented and trained individuals who are going to allow us to manage these devices and help us organize them and collect data sets that are going to allow better decision making so that we can contain costs, improve quality, and improve access to care. Next slide, please. And this is data from almost 20 years ago from Health Affairs, which basically says the factors that affect healthcare in a traditional healthcare ecosystem account for only about 10%. The rest of it comes outside the hospital or clinic setting. And that time is now, where we now have the power to collect this data and actually are able to synthesize it to deliver better outcomes. And I think that's what excites me as a physician, that now we can bring together people and technology, then think about new processes where we deliver care that is going to be impactful and that is actually going to be of high quality. Next slide, please. Next slide, please. So yeah, in today's date, what I can say is that frontline caregivers are drowning in information while starving for wisdom. And the classic example that comes to mind is walking into an ICU in a hospital, and all one hears is a number of beeps. And one of my friends, Dr. Robert Wachter, he had commented in his book a few years ago, when he asked the nurse, how do you know which beep is important? She said, when there is silence. And I think that is really a classic example of where an opportunity exists to transform healthcare. Can we begin to look at all these signals that are coming from all these devices and sensors and begin to synthesize them to allow a frontline nurse to make a better decision? Next slide, please. Unless we do something about this, our challenge with burnout is going to increase, and burnout is a big contributing factor to access issues as well as workforce challenges. Next slide, please. I'm going to skip through that because I think I'm almost out of time. Next slide, please. So, when I think about bringing this all together, we all need to be thinking about how do we begin to deliver great experience to our end users. Our prime customer is our patient, but our secondary customer are the frontline caregivers who are using all these technologies and all the data to deliver the care. And if we can begin to start looking at design thinking and improve usability of devices and technologies, we begin to look at data science and how do we actually make data retrieval and insight retrieval much easier and much more contextualized. How do we look at aligning people, process, and technology? And how do we begin to look at leadership and streamline governance and decision-making in an organization? Ultimately, I, as a frontline doctor, and I, as a patient, care more about the care that's being given to me and the eye contact that a doctor or nurse has with me than the technology is at play. So if we can work towards making technology an invisible factor, that would be success. Next slide, please. So this is a representation of a digitally distributed ecosystem where the patient's at the center and all the devices and technology is integrated and working with the caregivers to deliver the best possible care. And extended that to population health and public health, as pandemic has showed, we have a need, and as well as innovations and research. Next slide, please. And this is, again, a representation of how do we actually begin to create a mature digital healthcare ecosystem. And HIMSS has a number of great framework that actually articulate this. Next slide, please. And I think, so we move from the left where we have a number of devices and number of processes, but actually now organizing them with the patient at the center. Next slide, please. And this is final slide. And essentially, I want to stress one point in this, that culture always eats strategy for lunch. We as leaders must need to collaborate and work together to create a culture in our ecosystem that fosters innovation and teamwork and communication and performance excellence. And I think the tools are there. I think increasing knowledge and awareness like these webinars are doing are absolutely the right step to get us into the next generation. Next slide, please. With that, I thank you very much.
Thank you. Thank you very much, Dr. Manish. Actually, there were lots of information and lots of questions. and your presentation as well mentioned lots of topics that draws lots of questions as well.
And Riyadh, we will answer some of them after this program and get them out in the next week. So I'd like to move to the panel if that's all right.